This talk has been prepared especially for you. Yes, young people like you here in the audience. As adolescents, just starting out in life, your future stretches excitingly in front of you. But you also have a certain amount of responsibility for the success or failure of the years ahead. You may be surprised to hear that what you choose to eat can have a dramatic effect on not only your lives, but also your children's lives. In this presentation, we will try to explain how this comes about. During the last 100 years, better food and living conditions have led to an increase in our body size and height. But unfortunately, there has also been an increase in disease, especially heart disease, diabetes, cancer, and other illnesses. We now know that there is a definite link between diet and disease, and so the sort of food you eat as future parents will influence the intelligence and abilities of your children, as well as, most importantly, their health. There is one particular problem that has troubled this country over the last 40 years or so, and only your generation is capable of putting it right. The problem is the number of babies born with a low birth weight. Babies born undersize have a much poorer start in life than those born at a normal size. And here in the UK, we have one of the highest rates of low birth weight babies in Western Europe, the same as much less privileged countries such as Romania, Mongolia, and Kazakhstan. Why should the low birth weight of babies matter so much? The answer is because it has been found that a baby born weighing less than 2.5 kilos, or 5 pounds, is more likely to have chronic, that is to say continual ill health, brain damage and learning difficulties, whereas when the mother-to-be is well nourished, the chance of having a low birth weight baby is very much reduced. Here are some examples of healthy, full-term babies born at 40 weeks at a normal average weight of about 3.8 kilos or 7.5 pounds. And in contrast, here you can see some photos of low-weight babies. This baby was born at the normal 40 weeks, but underweight. You can see she has a pinched look about her. This baby is an extreme example, as she was very premature, having been born at only 26 weeks. Her chance of survival is only 80%. When a baby is born small, it will obviously be more delicate and will need specialist care, usually in a hospital special care baby unit for the early days and weeks of its life. Compared to a healthy baby, it will be at a disadvantage right from the start. It will be far more likely to pick up infections, and sometimes it will take the baby a very long time, if at all, to catch up in terms of growth and development. The most important thing to remember is that the baby in the womb draws its nourishment from the body of the mother right from the very beginning, long before she even realizes she's pregnant. A developing baby does not rely solely on food consumed by its mother during pregnancy, but draws on the nutrients stored in her body over the preceding months and years. So if you are planning your family sensibly, you must make sure well before conception that you are in tip-top health many months beforehand, not forgetting that this is equally important for the father. Obviously, no one would deliberately choose to put their baby at risk if, by simply eating sensibly, the risk could be reduced to a minimum. So, what does eating sensibly mean? In this picture, there are some examples of good food. By the way, the milk should be whole milk, that is, not skimmed, and the bread wholemeal, preferably homemade. Obviously, no one would deliberately choose to put their baby at risk if, by simply eating sensibly, the risk could be reduced to a minimum. So, what does eating sensibly mean? In this picture, there are some examples of good food. By the way, the milk should be whole milk, that is, not skimmed, and the bread wholemeal, preferably homemade. Supermarket bread that you can squeeze is not a true wholemeal loaf. White bread is so refined that it has had most of the essential vitamins and minerals removed and is therefore not a nutritious food anymore. Wholemeal bread is the best choice. Fish should be included in the diet at least once a week, especially oily fish such as herring and mackerel. A consultant physician said recently, "We know that sensitivity to a mother's diet begins very early and that life in the womb establishes the risk of coronary heart disease, increased blood pressure, strokes and diabetes. Yet so many young women are not getting their diets anywhere near right. Many of them are eating far too little fruit and vegetables and not enough dairy products." Young women who go on slimming diets before becoming pregnant risk having low birth weight babies with, as we have just seen, all the associated health problems. These babies have fewer kidney cells, which means that each cell has to work harder, and that can be very damaging to the kidney. Small babies also have fewer insulin-producing cells, which put them at a greater risk of developing diabetes and obesity in later life. Some low-weight babies do not survive, but those that do are at high risk of having learning difficulties, cerebral palsy, that is, impaired muscle control, or they could be born deaf or blind. In a study of 12,000 women aged 20 to 34 living in the Southampton area, it was found that 40% of them had a diet that was unsuitable for pregnancy. Another physician commented that unhealthy diets and faddy weight loss programs may be condemning a generation of babies to ill health. Every now and then, sad pictures of tiny babies needing heart-lung transplants appear in newspapers and on television. It is terrible to see a little baby like this one so desperately ill with a heart problem, and even though skilled surgeons do a magnificent job to try to give these tragic youngsters a better start in life, the dice are inevitably loaded against them, and sometimes the babies do not survive. You may ask, why are babies born with these defects in the first place? Well, we now know that poor nutrition is very often the cause. In animal experiments, when a mother's diet is deficient in some of the essential trace minerals and vitamins, her offspring are very much at risk of being born with something wrong with them. In the USA, a man called Francis Pottinger did some experiments on families of cats, and he discovered that by depriving the mother cats of vital nutrients in their food, both before and during pregnancy, the result was nearly always a difficult birth and the delivery of sickly kittens. Researchers have found that almost all the malformations observed in humans could be reproduced in newborn animals by altering the mother's diet during pregnancy. For instance, folic acid, one of the important B vitamins, that for us humans is vitamin found in abundance in green leaf vegetables, liver and yeast, is essential for the normal production of red blood cells. Mother animals deprived of folic acid produced virtually all types of abnormality in the heart, arteries and veins of their young. In humans, a great deal of research has been done to try and find ways to treat heart abnormalities such as these, conditions that might never have existed had the mothers been eating good, healthy food. Babies born with heart defects could well be as a result of deficiencies in the food of the mother, not only a lack of folic acid, which has just been mentioned, but other essential vitamins and minerals before and during pregnancy. Nervous disorders in young children may be caused in the same way. Inadequate nutrition, and in particular lack of vitamin E during pregnancy, is thought to be one of the causes of Down syndrome, since this vitamin plays a vital part in the development of the pituitary gland. If you had a luxurious sports car, you wouldn't dream of putting poor quality fuel in the tank or inferior oil in the engine. And yet this is what we do to our digestive systems every time we eat sugar-laden, processed, pre-cooked food full of unnatural chemicals and additives. Look on the label of what you buy, and if you find a long list of ingredients with unpronounceable names, just leave the product on the shelf. We are sure that none of you would knowingly risk the health of your babies by eating junk food. Tampering with food or eating food that has been altered by processing, as we have just seen, can have a very bad effect on your health and on the health of your children. A rule worth remembering is to try and eat food as near to the state in which it comes out of the ground as possible, especially raw fruit and raw vegetables. We now know that too much sugar acts like a poison on your liver cells, so try to avoid sugary cakes, biscuits, sugar-laden breakfast cereals, as well as sweetened fruit drinks and colas if you possibly can. They are harmful because they are empty foods. They don't contain any of the vitamins and minerals that are so important for the good health of both mother and baby. However, we're all human, and life is to be enjoyed, but not abused, so regard them as an occasional treat rather than as a food. You can now see how important it is to watch what you eat before planning to have a baby. Unfortunately, these days, apart from poor nutrition, there are other things that are even more of a threat to an unborn baby. Here you see some of the most damaging: alcohol, smoking, and drugs being the worst. Drinking alcohol, using drugs and smoking by mothers during pregnancy can seriously affect the health and development of their unborn babies. In the case of alcohol, just remember that pregnancy and alcohol don't mix. In fact, alcohol can affect your unborn child for life. Some people may tell you that a little alcohol is quite safe, but the best choice is not to drink any alcohol at all during pregnancy, or if there is a chance you may become pregnant. Alcohol will reach your unborn baby very quickly because it can cross the placenta, and your baby's blood alcohol level will be the same as yours, causing harm to its normal development. The reason why alcohol is considered dangerous is because it can affect the baby's physical growth and brain development. Alcohol can harm a baby at any stage during pregnancy. However, stopping drinking alcohol at any time during pregnancy will at least improve the outlook for the baby. Common signs of a drug-addicted infant are premature birth, low birth weight, and delays in development. This may result in the baby being unable to breathe properly because the lungs have not fully developed. Pregnant women should know that whatever they eat, drink, smoke, or snort may pass directly from their blood system into their baby's circulatory system through the placenta or the umbilical cord. Any type of illicit drug use alters the function of your baby's brain. The amount of brain damage, as well as how the damage affects a child later in life, depends on how often the mother used the drug, the strength and type of drug, and when the unborn baby was exposed to it. For example, since brain development goes through very rapid changes early in the pregnancy, drug use can have a more serious impact during the first few weeks after conception than later on in the pregnancy. Smoking during pregnancy affects you and your baby's health before, during, and after your baby is born. The nicotine, which is the addictive substance in cigarettes, carbon monoxide, and numerous other poisons you inhale from a cigarette, are carried through your bloodstream and go directly to your baby. We know that smoking while pregnant lowers the amount of oxygen available to you and your growing baby, increases the chances of miscarriage and stillbirth, increases the risk of your baby being born prematurely and or born with low birth weight, increases your baby's risk of developing respiratory, that is, lung problems, raises the risk of heart-related birth defects by 20 to 70%, especially in the first 3 months of pregnancy. Problems with the structure of the heart are most common, where the proper blood flow through the heart is interfered with, and this may affect breathing. Smoking also increases the risk of cleft lip and cleft palate. This is where there is an opening or split in the lip or roof of the mouth. They are birth defects that occur when a baby's lip or mouth do not form properly. The more cigarettes you smoke per day, the greater your baby's chances of developing these and other health problems. There is no safe level of smoking while pregnant. It should be said that the majority of babies are born with no pre-birth related problems, but it is always wise to know beforehand when there are risks that can be a threat to a baby's well-being. Every parent wants a happy, healthy child that can grow normally and develop its full potential for a successful life. When you know the pitfalls, you also know how to avoid them. One of the first people to fully realize that human health was directly linked to the wholeness of food, that is, food that has not been altered by processing, was Sir Robert McCarrison. He was an English army doctor who lived in India, and he noticed that the people who lived in poverty in the big cities were eating poor quality food full of sugar and starch, which had the effect of stunting their growth and making them ill. On the other hand, the people who lived in the mountains were well nourished. They ate fresh, naturally grown fruit and vegetables, eggs, butter, milk, a little meat, and unprocessed brown rice, lentils, and wholemeal bread. They had strong, well-formed bodies and a remarkable resistance to disease. The food they ate had a direct impact on their health, and Sir Robert realized how closely linked nutritious food is to good health, and how faulty eating is responsible for illness and poor health. In connection with this, a remarkable dietary experiment was carried out in a village in Cheshire. By following Sir Robert's advice on the best type of food to eat, there was an almost miraculous improvement in the health of the people who lived in the village, especially the health of the children. The children were splendid. Many of them had perfect sets of teeth, and they slept well. Lung infections such as bronchitis were almost unknown. One of their most striking features was their good humour and happiness. They were well-developed normal children with strong limbs and beautiful skins. This was not a scientific experiment. It was part of the work of a doctor's family practice. The people used in this experiment were entirely unselected, and the food was not specially grown. But in spite of that, by listening to Sir Robert's advice about what sort of food to eat, they were able to show what a big improvement could be achieved in just a single generation. Finally, having listened to this talk, you will have seen what an important part you young people have to play. Bringing a new life into the world is a big responsibility, and this, of course, includes young men just as much as young women. We sincerely hope that when you become adults, you will have enough strength of character and vision for the future to see that when the time comes to start a family, by not indulging in drinking alcohol, drugs and smoking, and by eating health-giving food before conception, you will give your babies the greatest gift you can bestow. That is, a bright and healthy start to life. After all, isn't that what every baby deserves?